Hello everyone, today we're going to do a walkthrough of osteopathic sacral dysfunctions. Now, if you're suffering or you know someone who is suffering from sacral dysfunction, this video might be helpful. Let's talk about different motions of the sacrum. Sacrum is where the spine meets the pelvic and help with weight transfer to the innominate bone, which transfer weight to your legs. The sacrum is able to bend and tilt in several different planes and to accommodate different movements. Sometimes, due to trauma or abnormal weight bearing for an extended period of time, the sacrum gets stuck. And so there are several types of sacral dysfunctions, but let's talk about a little bit about the landmark anatomy. For sacral dysfunctions, the most important landmarks are the sacral sulci and the inferior lateral angle, IOA, right here. If you want to palpate for the sacral sulci, first you need to find the innominate and then look for the PSIS and then you step down. Here is the sacral sulci. And in order to palpate for the IOA, first you need to palpate using the heel of your hand and then palpate down the sacrum. Kind of feel the end of the sacrum where it drop up, and then you go out to the side, and that's where you have your IOA. And the last landmark of sacral dysfunction is the L5 vertebrae, which is right on top of the sacrum, but we will talk into detail of the L5 vertebrae later. The sacrum can stuck again the innominate bone on the right side or the left side, bilaterally or unilaterally. Now we start with the left and right dysfunctions. So the sacral dysfunctions are named by the pathologic axis that they're stuck on, either left or right. You can think of the dysfunctional axis as either running through the right side or running through the left side of the superior portion of the sacrum. So just for visual sake, if the sacrum is stuck on the right axis, like this, the axis will coming through right here, and as if the sacrum is actually rotating along the pathologic axis. And this is not how usually the sacrum move, and this is not healthy at all. And the opposite of the right axis is the left axis. So if the sacrum is stuck on the left axis, the axis will coming through here, and the sacrum will actually rotating along those lines. I've also drawn it here as well. So this is how I draw the sacrum when I'm working on a sacral problems. So the left axis grows on the left side, and the right axis just grows out on the top of the right side of the sacrum. So for left and right sacral dysfunctions, when we talk about a problem, we always use left. I always try to describe as left on left or right on right, right on left or left on right. The first word is the axis, and the first is the rotation of the pelvic on that axis. First one we have left on left, so we know that the second left is the axis, so it's coming from the left axis, and the rotation is on the left, so it's rotating to the left side. Left on left or right on right, it is anterior rotation. So for the left on left one, we have left axis and left rotation. With left on left, we will have a shallow left sulci and left IOA, with deep right sulci and deep right IOA. The second type of rotation is posterior rotation. You can think of them as rotating posteriorly along the axis line, where the anterior rotation rotates anteriorly. For posterior rotation, you will have left on right or right on left. So let's start with the left on right. You will have right axis and left rotation. So with left on right, you will have shallow left sulci and shallow left IOA with deep right sulci and deep right IOA. To recap, start with an axis and then we think which way the sacrum is rotated and then we think what that would do to the different landmarks. So real quick, I want to talk about the sacrotuberous ligament. So let's say the patient come in with tight sacrotuberous ligament on one side and loose on the other side. All this means in factoring this into your diagnosis of a sacrum is that on the tight side, the IOA is shallow, also known as posterior, and on the loose side, the IOA is deep, also anterior. And now we're going to talk about how L5 vertebrae fit into the sacrum puzzle here. We know that the L5 vertebrae sits on top of the sacrum, and there are two laws with L5 and sacrum mechanic. So the first law that you need to know is the L5 rotates opposite of what the sacrum does, and the second law is the side bends same side as the axis. So for example, here we have a left on left problem. So we start with a left axis and left rotation. So the sacrum will look like this, and I don't have a L5 model with me, so I use the stick as an example. So the first law we have the L5 rotates opposite of what the sacrum does. So the sacrum rotates to the left side. So this is L5 sit on top of the sacrum, and so the sacrum will rotate the opposite way, so it rotates to the right. And then the second law is the side bends same side as the axis. So the axis is on the left side, so it bending to the left. And I think of this as like a pinch. So and if you ever have something like this does really feel like something pinching in there, and patients will actually say that too when they come into the clinic. So now we're going to talk about some of these weird dysfunctions, but they are pretty straightforward. The first one we have the bilateral flexion. So you have the sacral base is bilaterally flexed between the two innominate bones. So they have deep sacral sulci bilaterally. And for a bilateral extension is the exact opposite of that. So that both of the sacral sulci are shallow bilaterally. So both are shallow. The unilateral dysfunction are basically a dysfunction that doesn't really fit into what the other dysfunctions that we already covered. So a unilateral flexion or extension will just be one sacral sulci either flex or extend either on the right side or the left side of the sacrum. Okay, now I'm going to talk about the different types of sacral testing. The first one is the Siddis flexion test. It is the most common and it's kind of your bread and butter sacral test. So what happens is you have your patient sit down in front of you and then you have them bend forward. So this will lock out the innominate. You are not testing the innominate, so this is actually test which side sacrum is catching which innominate. So as the patient bends forward, that innominate will bend forward. And whatever the innominate goes forward, your axis will be on the opposite side. For instance, you have someone sit down in front of you and then you have them bend forward. And then their PSAS will way further on the right side. It just means that your axis is coming through the left side. So now the spring test. It is very easy to overcomplicate it, but the spring test is positive if there is no springing and negative if there is springing. All you do with the spring test is basically you put the heel of your hand onto the face of the sacrum and then you push down. And if this patient has posterior rotation, the sacrum will not spring, which means that it is stuck backward. So if the sacrum is rotate anteriorly, then it springs just fine. But if it's stuck posteriorly, it will not spring, which give you a positive spring test. So the last one is the Sphinx test. So in this test, you actually have the patient lay down flat on their stomach, and then you have them get up on their hands, kind of like a Sphinx. That's the name. Then you check if the two landmarks get more symmetrical when they do the test. If the landmarks are more symmetrical, that means that you have a anterior rotation. So to put this all together, if you have a positive flexion test, you're gonna have an anterior rotation or posterior rotation dysfunction. From there are two special tests, are the spring test and the Sphinx test. And yet, if you have a positive Sphinx test, you have an anterior dysfunction. And if you have a negative spring test, you have a posterior rotation dysfunction. For spring test, if you have a positive, that means that you have posterior rotation, and for negative, it is anterior rotation dysfunction. And if you have a negative on the flexion test, that means that you have weird dysfunction or no dysfunction. So to put it into practice, let's say a patient comes into the clinic complaining of lower back pain, and you suspect of an osteopathic sacral dysfunction. So with the flexion test, it is positive on the left side, and the spring test is also positive. The left sulci is posterior, also means shallow. So what is the most likely diagnosis? You can pause the video to solve this if you like. Okay, so the answer is left on right. So the axis is on the right side because the flexion test is positive on the left. The sulci on the left is shallow or posterior, so this is how the sacrum rotates on the right axis. So the spring test is just an extra information because we know that positive spring test is posterior rotation dysfunction, and left on right is a posterior rotation. So for a follow-up question, what is the diagnosis for L5 vertebrae? You can pause the video again if you like to work on the questions. For L5 diagnosis in this case, just remember that L5 rotates the opposite side as the sacrum, and side bends are the same side as the axis. So we have a left on right problem. The sacrum will rotate like this, and the L5 sit on top will rotate the opposite side, which is the right side, and then side bend to the same side as the axis, or side bend like this. So it's rotate to the right side and side bend also to the right.